So if you're always tired, if you're always fatigued, and you still haven't figured out why, in this video I'm going to give you 7 causes of fatigue. Then at the end of this video, just as a bonus, I'm going to let you in on a personal secret on my struggles with fatigue. So out of the 7 causes that I'll be discussing today, I actually have 4 of these. I'm going to tell you which 4 I have and what I'm doing to treat these. So lack of quality sleep. I put this one at the top of the list, not just because it's so common, but because this is something we can actually do something about. We can actually take measures to improve the amount of quality sleep that we get. Okay, so here's the number 1 recommendation, and by far this is going to be the toughest recommendation of the day. Turn off your electronics. Turn off your cell phone, turn off your laptop, turn off your desktop computer about 45 minutes prior to going to bed. So with TikTok, with Instagram, with Facebook, with YouTube, all of these are vying for our time, for our attention. So this one's not going to be easy to follow. This one alone could improve the quality of your life, especially if you're on social media to the wee hours of the morning. Hypothyroidism. So we've all heard of this one, but what might clue you into this diagnosis? Well, there are a couple of signs and symptoms for which we monitor, which may kind of give you an idea, may clue you into the fact that you might want to get your thyroid checked out. So, what do we look for? We look for weight gain, constipation, cold intolerance, and you got it, thinning of your hair. So how do we get this one diagnosed? With the lab test, it's a simple blood draw. It's called a TSH, or thyroid stimulating hormone. And what's the treatment for an underactive thyroid? You got it, thyroid hormone replacement, which is usually a medication called levothyroxine. Alright, if y'all are enjoying this video and you like this type of content, hit the like button. And I definitely want you to comment on today's video. So if you have something to share with the class, maybe your own personal story of fatigue, maybe what you were diagnosed with and how you got it treated, let us know. Depression. This one is often overlooked by physicians as a cause of fatigue. But depression, it can definitely zap all of your strength, your energy, and just leave you feeling like you're wiped out. So if you think that you might be depressed, or if someone has mentioned to you that you're just not your old self anymore, make sure you get this checked out. Make an appointment with your PCP or your psychiatrist. Oftentimes they'll use a 2-pronged approach, which is counseling and antidepressant therapy. Okay, number 4. This one is huge. And this one too is often overlooked. So dehydration is probably more common than you think. Personally, in my own medical practice, I see this every day. I make house calls to the elderly, debilitated, and homebound patient. And what I've seen over the years is that as we get along in life, our thirst and our appetite starts trending downward. You can also see this in a highly active patient population, or in people who have jobs that are very physically demanding, and it's easy for these people to be in a constant state of dehydration. So on the flip side, poor dietary habits. It's essential to have a diet that consists of nutritious and well-balanced meals. And it's also paramount to take in enough calories so that we can feed our machine. We'll sometimes see this in people who are on these super restrictive diets, and aside from being calorie deprived, sometimes they'll be deficient in some of the key nutrients. Alright, number 5, medications. Medications. Alrighty, there's so many medications out there that can just put you in a funk. So the best way to sort this out, at least in my opinion, is to list the top classes of medication that are most apt to cause you to be fatigued. So at the top of the list is beta blockers. Beta blockers are used to treat high blood pressure. Next, statin medications. These are used to treat cholesterol, high cholesterol. Another category of medications that can cause tiredness and fatigue are medications that are used to treat depression, mainly a class known as SSRIs. Most of you have probably heard of these. They include medications like Lexapro, Paxil, Prozac, Zoloft. So these are just 3 classes of medications which can definitely cause you to feel like you're wiped out. There are many, many more. So if you think that one of your medications might be causing you to be fatigued, get in touch with your PCP to discuss this. Sleep apnea, restless leg syndrome. Okay, sleep apnea and restless leg syndrome. So I lumped these together because both of these can just absolutely wreak havoc on your sleep pattern. And also both of these are diagnosed the same way with an overnight sleep study. So with an overnight sleep study, what is an overnight sleep study? These are not fun. This is the one test that is the hardest to get patients to agree to do. So with an overnight sleep study, you're going to be sleeping at a strange place you've never slept before. You're going to be wired up from head to toe, and you're going to be videotaped throughout the night. Kind of creepy. Okay, that's why this is the hardest test to get someone to agree to do. But if you have sleep apnea and or restless leg syndrome, having this study could be a game changer. For sleep apnea, a condition in which you stop breathing for a period of time during sleep, they will set you up with a CPAP machine, kind of like this one. So the goal here, wear the mask throughout the night. If you can accomplish this, most people will see a dramatic decrease in their level of fatigue. So this brings us to the last cause of fatigue on this list, and that's restless leg syndrome. So with this, the patient is kicking or jerking during sleep, sometimes thousands of times throughout the night. And in many cases, they don't realize that they're doing this because it never fully arouses them from sleep, but it will destroy their sleep pattern. So treatment for this is usually prescription medication. The two most common medications for this being pramipexole and ropinirole. Both of these medications are effective. So there you have it, 7 common causes of fatigue. So I urge you, if you're fatigued, get in touch with your primary care doctor. Now there are many, many more causes of fatigue that I didn't touch on today, such as vitamin B12 deficiency, diabetes mellitus, congestive heart failure, chronic fatigue syndrome, and I can go on and on and on and on, but this video would never end. And as I promised at the beginning of this video, my 4 reasons for being fatigued. Number 1, poor sleep habits. Number 2, restless leg syndrome. Number 3, hypothyroidism. Number 4, sleep apnea. Again, thanks for joining me for my very first YouTube video, and I'm really looking forward to putting out many more videos just like this. Bear with me though, I'm a full-time practicing physician, and these YouTube videos, it's all me. This is a crew of one. So I'm going to try and put these out as quickly, as efficiently as I possibly can, but I also do want to do a good job. So again, thanks, and I'll be seeing you guys soon. Stay safe.